I'd like to draw everyone's attention to this manuscript that's out in the lobby. It's written by Emily Zimmerman and Stephen, who presented to us this morning, our keynote. Please pick up a copy, okay? It's called Understanding the Relationship Between Education and Health. I hope everyone had a good lunch, a great conversation. I'm sorry to break up the conversations, but we have to get started for the afternoon session. So first, I'd like to remind everyone that the workshop is being recorded and also webcast. Okay? So do we have all the panel 2 speakers at the table? You please come to the front and take a seat. That's it. Okay. So the second panel today will be moderated by Holly Hunt, and Holly is the branch chief of the School Health Branch in the Division of Population Health of the CDC's National Center for Chronic Disease Prevention and Health Promotion. Welcome, Holly.
Thank you, Jillian. I want to first say how extremely exciting it's been to hear all these presentations and discussions this morning. This is a topic, especially this next panel presentation, very near and dear to our hearts at CDC. As many of you know, we've been working for many, many years to bring the worlds of education and health together. So it's just really exciting to hear how much movement we're making in this direction. The other piece I wanted to share with you is that I know that folks have heard about different changes at CDC. We do, in fact, have 2 units that specifically focus on school health. One is in my branch, which is very focused on physical activity, nutrition, and the management of chronic conditions in schools. And we still have the Division of Adolescent School Health, which we have Stephanie Zaza, who is the director of that division, and also Bill Potts-Datema here as well with CDC. And both units do work together, particularly around our surveillance and research efforts. And then I think most of you are aware that much of our research is in the form of translation into user-friendly schools for tools. So we kind of continuously work to put the health language into the education language, as has certainly been referenced here today earlier. I think everyone knows that you all will have a prompt when we have about 5 minutes per speaker. We'll have time for questions after everyone has an opportunity to speak. I think we're going to start first with Jim Bender, who is the Executive Director of the National Education Association Health Information Network. Jim?